When a woman's in labor, her options for pain relief include, of course, the IV medication that her obstetrician may prescribe for, but also epidural, which is probably one of the most common non-IV pain relief modalities that are used for labor and delivery. The ones that we use primarily here, certainly, and probably most hospitals, are labor epidurals, where we actually would put an epidural catheter into a laboring woman's back and infuse pain medicine through it. A woman can get an epidural usually when her obstetrician determines that she is at a stage of labor where it can relieve her pain, but also where she's making good progress in her labor. You don't want to put it in necessarily until you're absolutely sure that she is truly in labor. A lot of ladies are familiar with the term false labor. You want to make sure she's not in false labor before we put her through the process of putting in an epidural. In experienced hands, placement of an epidural partly depends on mom's cooperation. If she can sit still, most of our providers can get an epidural in within 10 minutes, sometimes less. And then once you dose the epidural, we usually can achieve good pain control within another 5 to 10 minutes after that. So in most cases in our hospital with our providers, we can typically have a woman with significant relief in her labor pain within 10 to 15 minutes of walking in the door, and certainly within 15 to 20 minutes she can be almost pain-free and back to her normal happy self. An epidural is extremely safe. A lot of our moms who require epidurals will ask us questions like, can I be paralyzed? Will I get an infection? Will it hurt? And the answers to that is, number one, the paralysis likelihood is extremely small. In most cases, it's an old wives' tale that they heard from someone. And I often ask my patients, do you know anyone who was ever paralyzed from an epidural? And say, no. I say, so you heard it from somebody? And they say, yes. The risk of infection, very small. Like most things, a person with experience in putting in epidurals is not going to pose any significant risk to mom at all. And so an epidural is extremely safe. It's also very effective and something that if I were having a baby, I would certainly want. Pregnant women are at an increased risk of complications from general anesthesia, which is being put to sleep and being completely unaware of anything going on. So we try to avoid that. One of the ways we can avoid that is with an epidural. Just like the epidural is placed to control pain of labor, it can also be redosed with a stronger medication to take away the sensations completely from about the lower ribs on down so that she can undergo a C-section without pain. If she does not have an epidural, however, and it's not emergent, because in emergencies we'll typically do a general anesthetic, then we'll often do what's known as a subarachnoid block or a spinal anesthetic. Some ladies may be familiar with the term saddle block. This is not truly a saddle block. That refers to an anatomically different block, but the process of putting it in is the same. We would clean off the back with sterilizing solution, numb up an area of the back where we're going to place the needle, place the very, very thin needle through the numbing area, and then inject the medication that will make her numb, usually from around the lower ribs all the way down so that she doesn't experience any pain with the C-section. And also one of the nice things about that is she's awake. She can enjoy the delivery of her child. Her support person can come in with her, hold hands, and all those things that we like to be able to provide for our patients. Things that would prevent a woman from getting an epidural would include an infection at the site where we would need to place the needle, because we don't want to run the risk of taking infection, bacteria, tissue into the area around the spinal cord or into the spinal cord, because that could cause potentially life-threatening infections such as meningitis or an abscess around the base of the spine. Other things that could prevent her from getting an epidural would be rods or any types of artificial material that could be present if she had had surgery on the lower back or trauma. But the most common reason that a woman can't get an epidural that we see, and it's actually fairly rare anyway, is a low platelet count. Platelet counts are absolutely necessary for your blood to clot. And so if the platelet count is abnormally low, then the mom's blood would not clot normally. And our placement of an epidural could actually cause a large hematoma to form, or blood clot that could have some negative effect on her extremities. And in those rare instances, you would have to be concerned about the possibility of paralysis.